For my discussion board this week, I chose the article Swiss Group Will Euthanize Those Who Feel Old. So the article discusses how there's a group in Switzerland that will now extend their assisted suicide program choice to patients who simply feel old. And it's not just for terminally ill patients. So primarily when we discuss euthanasia and assisted suicide, what we're talking about is for terminally ill patients who are going to die within the next 6 months or so. But this group called Exit can now has now allowed suicide due to old age in its statute. So Switzerland does not have like a regulating body that says what terminal diseases can and cannot be treated with assisted suicide, but they have individual associations who can pick what their statutes allow. And this specific association, Exit, has decided to allow old age. So their members who have age-related problems, either psychological or physical, are allowed to undergo assisted or physician-assisted suicide. And they came to that conclusion in 2014. And it was criticized by a lot of people back then. They fear that such a move could cause a large amount of suicide in the elder population, those who may not have any terminal problems or just have, age-related macular degeneration or age-related renal failure. But even people who aren't necessarily for or against it, a lot of people say that it's a long process. So even for patients who feel old, they still have to go through a series of tests, and they have to talk to doctors for a lot of time, many days, before they even reach a conclusion. And the patient must justify the reason that their choice is, reasonable. So I don't think that, personally, I think that euthanizing somebody because they're older is appropriate. I don't think it's I wouldn't say it's not a right to die, but it's, if you don't have any true terminal problem, everybody goes through life and everybody dies. And if you just feel old and that's the reason that you want to, I don't feel like that's an appropriate reason for physician-assisted suicide. And that's my general opinion. I think it's too far of a step for physician-assisted suicide to handle.